Always nice to see you, Dr. Mellis. Your talk on medicinal plants drew quite a crowd.
Thank you. It's encouraging to watch interest in herbs grow outside my usual circles.
Indeed. But you finished with the claim that herbs are often the better first line of treatment. I'm curious, better than evidence-based pharmaceuticals? How so?
Fair question. Let me give you 5 quick reasons. 1. Whole plant synergy. Most herbs contain dozens of active compounds that work together. Think of turmeric's curcumin plus its natural oils enhancing absorption. The ensemble can balance efficacy with gentler side effect profiles. 2. Chronic care fit. For low-grade inflammation, mild anxiety, sleeplessness, sluggish digestion, conditions that account for a huge slice of clinic visits, herbs such as chamomile, ashwagandha, or ginger calm symptoms and nurture underlying balance rather than merely suppressing signals. 3. Preventive mindset. Daily herbs in food or tea, garlic, holy basil, rosemary, can lower baseline risk before pathology sets in, whereas drugs usually enter the story after disease appears. 4. Cultural continuity. Millions trust remedies their families have used for generations. Respecting that heritage builds adherence, which, as you know, can make or break any therapy. 5. Accessibility and cost. A month of dried hibiscus for mild hypertension costs a fraction of many patents, which matters in low-income settings.
I'll grant those points, but I worry about standardization. With herbs, potency can swing wildly depending on species, soil, harvest time.
Absolutely. It's the Achilles heel. That's why I source from certified growers and send batches for third-party chromatography. Standardized extracts like EGB 761 for ginkgo or WS 5570 for St. John's wort show we can quantify plants just as we dose pills.
Fair. My other concern is interactions, St. John's wort lowering serum levels of antiretrovirals, for example.
Which is why herbal medicine must be practiced by professionals, not guesswork from social media. We take full drug herb histories, run databases like natural medicines, and adjust plans, just as you'd taper steroids before a vaccine.
You sound more like a pharmacologist than the stereotype of a folk healer.
Botany and biochemistry are my daily bread. My position isn't anti-drug, it's pro-appropriate tool. Herbs shine for functional issues and prevention. Pharmaceuticals shine for acute crises, strokes, sepsis, severe asthma.
So your argument is that herbs are better where the goal is long-term balance rather than rapid rescue.
Exactly. And using them early can sometimes keep patients from ever needing high-dose synthetics with heavier adverse effect profiles.
If we integrated your protocols upstream, hospital readmissions for lifestyle diseases might drop. But we'd need rigorous trials.
Agreed. Evidence convinces policymakers. Fortunately, Phase 2 studies on ashwagandha for anxiety, berberine for type 2 diabetes, and lavender oil for insomnia are piling up. Let's collaborate. Combine herbal prehab with your standard care and publish outcomes.
Deal. Maybe next year's keynote will be our joint data.
Looking forward to it. Meanwhile, how about swapping protocols over some ginger mint tea? It's anti-inflammatory and tastes better than that conference coffee.
Lead the way, Dr. Mellis. I could use a healthier habit.
Bottom line. Herbs are often the better choice for everyday maintenance and early intervention, when they're sourced responsibly, dosed accurately, and coordinated with conventional care. Click like and subscribe if you are inspired.